Do you know what is the most common cause of death in the world? You might think it's cancer, heart disease, or accidents, but you're wrong. The answer is ignorance. Yes, you heard me right. Ignorance is the number one killer because many people ignore the warning signs their body is sending them. And by the time they realize something is wrong, it's too late. That's why it's so important to listen to your body and pay attention to any changes or symptoms that seem unusual or persistent. Your body is your best friend, and it's trying to tell you something. Don't ignore it. So, without further ado, let's dive into the 13 hidden signs your body is trying to warn you about something. And trust me, some of these will surprise you. Number 1. You always feel cold. Do you always feel like you need an extra layer of clothing, even when everyone else seems comfortable? Do you shiver easily or have cold hands and feet? If so, you might have hypothyroidism, which is a condition where your thyroid gland doesn't produce enough thyroid hormones, which regulate your metabolism and body temperature. Hypothyroidism can also cause weight gain, fatigue, hair loss, constipation, and depression. To diagnose hypothyroidism, you need a blood test that measures your levels of thyroid-stimulating hormone, TSH, and thyroxine, T4. If you have low T4 and high TSH, it means your thyroid is underactive and you need medication to replace the missing hormones. Number 2. You have white patches inside your mouth. If you notice white patches or spots on your tongue, gums, or inner cheeks, it could be leukoplakia, which is a condition that causes abnormal growth of cells in the mouth. Leukoplakia is often caused by smoking or chewing tobacco, but it can also be a precursor to oral cancer. That's why you should never ignore these white patches and see your dentist or doctor as soon as possible. They can examine your mouth and perform a biopsy if needed to rule out any malignancy. Number 3. You've been having really intense dreams. Do you often have vivid, realistic, or even scary dreams that you remember clearly when you wake up? Do you sometimes act out your dreams or talk, scream, or kick in your sleep? If so, you might have a sleep disorder called REM sleep behavior disorder, RBD, which causes you to lose the muscle paralysis that normally occurs during REM sleep, which is the stage of sleep where most dreaming happens. RBD can be dangerous because you can injure yourself or your partner while acting out your dreams. But what's even more alarming is that RBD can be an early sign of Parkinson's disease, a degenerative disorder that affects your movement, balance, and coordination. According to the American Parkinson Disease Association, up to 80% of people with RBD will develop Parkinson's or a related condition within 10 years. So, if you have RBD, you should see a neurologist and get a thorough evaluation. Number 4. You have nail ridges. Nail ridges are lines or grooves that appear on your fingernails or toenails. They can be vertical or horizontal, and they can have different causes and meanings. Nail ridges are not always a cause for concern, but they can sometimes indicate an underlying health problem. Vertical nail ridges are more common and usually harmless. They may appear as you age due to a decrease in cell turnover or due to dry skin, eczema, or thyroid disease. Horizontal nail ridges, on the other hand, also known as Bowes lines, are more likely to be a sign of something serious, such as infection, trauma, chemotherapy, kidney disease, diabetes, or zinc deficiency. Horizontal nail ridges can also indicate that your nail growth was interrupted by a severe illness with high fever, such as COVID-19, measles, or pneumonia. Nail ridges can also affect the texture, shape, and color of your nails and cause them to become brittle, spoon-shaped, or discolored. If you have nail ridges that are persistent, severe, or accompanied by other symptoms, you should see your doctor and get a nail exam, a blood test, or a biopsy to find out the cause. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. You have dark urine. The color of your urine can tell you a lot about your health. Normally, your urine should be clear or pale yellow. indicating that you're well hydrated and healthy. But if your urine is dark yellow, brown, or even red, it could be a sign of dehydration, infection, kidney stones, or liver disease. Dark urine can also be caused by certain foods, such as beets, blackberries, or rhubarb, or by certain medications, such as antibiotics, laxatives, or antimalarials. To determine the cause of your dark urine, you should drink more water and see if the color changes. If it doesn't, or if you have other symptoms, such as pain, fever, or jaundice, you should see your doctor and get a urine test, a blood test, or an ultrasound to rule out any serious conditions. Number 6, you have a persistent cough. A cough is a common symptom of many respiratory infections, such as the common cold or the flu. But if your cough lasts longer than 3 weeks, or if it's accompanied by other symptoms, such as blood, mucus, chest pain, shortness of breath, or weight loss, it could be a sign of something more serious, such as lung cancer, tuberculosis, or chronic obstructive pulmonary disease, COPD. A persistent cough can also be caused by other factors, such as smoking, allergies, asthma, or acid reflux. To find out the cause of your cough, you should see your doctor and get a chest X-ray, a sputum test, or a bronchoscopy, depending on your case. Number 7, you have a sudden urge to move your legs. If you feel an uncomfortable sensation in your legs, such as tingling, crawling, or itching, that makes you want to move them, especially at night, it could be due to restless leg syndrome, RLS, which is a neurological disorder that affects the nerves in your legs. RLS can interfere with your sleep quality and cause daytime fatigue, mood problems, and poor concentration. RLS can be triggered by stress, pregnancy, iron deficiency, kidney disease, or certain medications. To diagnose RLS, you need a physical exam, a blood test, or a sleep study, and to treat it, you need medication, massage, exercise, or lifestyle changes, depending on the cause and severity of your case. Number 8, your eyes are always super dry. If you feel like your eyes are constantly dry, irritated, or burning, it could be more than just allergies or staring at your computer screen too much. It could be a sign of Sjogren's syndrome, which is an autoimmune disease that causes inflammation of the tear-secreting glands in your eyes, leading to a reduction in tear production and chronic dry eye issues. It can also cause your mouth to become dry and affect other organs like your kidneys, lungs, and liver. So, if you have dry eyes and mouth, along with fatigue, joint pain, or swollen glands, you should see your doctor and get tested for Sjogren's syndrome. Number 9, your fingers change color after being out in the cold. If your fingers turn white, blue, or purple after being exposed to cold temperatures, it could be due to Raynaud's disease, which is a condition that affects the blood vessels in your fingers and toes. Raynaud's causes your blood vessels to narrow and spasm, reducing the blood flow to your extremities and making them change color. Raynaud's can also cause numbness, tingling, pain, and swelling in your fingers and toes. Raynaud's can be triggered by stress, smoking, or certain medications, but it can also be a sign of an underlying autoimmune disease, such as lupus, scleroderma, or rheumatoid arthritis. That's why you should see your doctor if you have Raynaud's and get tested for any possible causes. Number 10, you have a metallic taste in your mouth. If you suddenly notice a metallic or bitter taste in your mouth, it could be due to a number of reasons, such as poor oral hygiene, dental problems, medication side effects, or food poisoning. But it could also be a sign of a more serious condition, such as kidney failure, liver disease, or diabetes. These conditions can affect your sense of taste and make you experience a metallic or sweet taste in your mouth. They can also cause other symptoms, such as nausea, vomiting, fatigue, swelling, or increased thirst and urination. If you have a metallic taste in your mouth that doesn't go away, you should see your doctor and get a blood test, a urine test, or a liver function test to check for any possible problems. Number 11, you have a swollen tongue. If your tongue feels enlarged, inflamed, or sore, It could be due to a condition called glossitis, which means inflammation of the tongue. Glossitis can be caused by various factors, such as infections, allergies, injuries, or vitamin deficiencies, but it can also be a sign of a more serious condition, such as anemia, celiac disease, or oral cancer. Glossitis can also affect your speech, swallowing, and breathing, and make you more prone to infections. If you have a swollen tongue that doesn't improve with home remedies, such as rinsing your mouth with salt water or taking antihistamines, you should see your doctor and get a physical exam, a blood test, or a biopsy to find out the cause. Number 12. You have a lump in your neck. If you feel a lump or a swelling in your neck, it could be due to a number of reasons, such as an enlarged thyroid gland, a swollen lymph node, a cyst, or a goiter. But it could also be a sign of a more serious condition, such as thyroid cancer, lymphoma, or head and neck cancer. A lump in your neck can also cause other symptoms, such as difficulty swallowing, breathing, or speaking, hoarseness, or pain. If you have a lump in your neck that doesn't go away after 2 weeks, or if it grows larger or harder, you should see your doctor and get a physical exam, a blood test, an ultrasound, or a biopsy to determine the cause. Number 13. You have a yellowish tint to your skin or eyes. If your skin or eyes look yellowish, it could be due to jaundice, a condition that occurs when there is too much bilirubin in your blood. Bilirubin is a yellow pigment that is produced when your red blood cells break down, and it is normally eliminated by your liver. But if your liver is damaged or diseased, or if there is a blockage in your bile ducts, bilirubin can build up in your blood and cause jaundice. Jaundice can also be caused by other conditions, such as hepatitis, cirrhosis, gallstones, or pancreatic cancer. Jaundice can also cause other symptoms, such as dark urine, pale stools, itching, or abdominal pain. If you have jaundice, you should see your doctor and get a liver function test, a blood test, an ultrasound, or an MRI to find out the cause. So these are the 13 hidden signs your body is trying to warn you about something. Did any of these surprise you? Have you ever experienced any of these signs? Let us know in the comments below and share this video with your friends and family so they can also be aware of these signs and take care of their health. And remember, your body is your best friend and it's trying to tell you something. Don't ignore it. Thanks for watching.